So, Crowley, thank you for having me. And I think it's really important to clarify. We have completed the phase 3 efficacy trial. Significantly, 7,000 South Africans contributed to the 43,000 people who went through that clinical trial. The trial finished in January. That data is now has been collected, put together, and is in front of the FDA for emergency use approval to actually be able to be used in a rollout fashion. So we have unequivocal clinical trial data now that this vaccine is effective and that it is safe. And this has actually been tested in our population here in South Africa. So that part of the research and development plan for this vaccine is complete. Yeah. So I think that's really important to say. The period we're in at the moment would have been dead space, if you like, the waiting for our own regulators to see the data, to review it, and then also act on an emergency use approval type process. Whilst we are waiting for those processes to happen, we have been able to get approval to use the vaccine in a open label rollout fashion where we will continue to evaluate effectiveness. So this is no longer about efficacy. We know it works. We will obviously continue to monitor safety as we always do, even when we roll out in a commercial way. But we are now into a next implementation phase rather than a clinical trial.
Prof, and make us understand, perhaps as a way of confirmation, the trials that were conducted, they were also conducted here in South Africa, if I'm not mistaken. Talk to us about the extensive nature of these trials. What am I talking about? I'm talking about the kinds of people that these vaccines were tested on. These are people that are either young, people with seriously compromised immune systems, and importantly, the elderly. Were those the kinds of groups that these vaccines were tested on?
Yes, so the eligibility criteria for the whole trial, it was called ensemble. People will hear that term being used. The trial, the phase 3 ensemble trial, enrolled 43,000 people who had to be over the age of 18, and there was no upper limit to age. Now, here in South Africa, we particularly wanted to be sure that the vaccine would be useful in the people who have the worst outcomes with SARS-CoV-2 infection. So we pushed the age above 55. So we insisted that our clinical trial sites really try and target, recruit people over the age of 55. So we have a good representation of older folk and people suffering from comorbid conditions. So again, we know those people don't do as well if they become infected with SARS-CoV-2. So there is very good representation of the typical target age that we would want to have in a trial like this. So South Africa contributed 15% of the whole trial cohort. It's about a 50-50 mix, women and men. And as I say, a very nice spread of age with very good representation of the elderly, comorbid, including people living with HIV. So I think, from that point of view, we have exposed all kinds of individuals to this vaccine with no safety signals to worry about at all.
Yeah, and Prof, speaking to someone yesterday, they also said that the variant that we are experiencing in the country, the vaccine was also tested there and it proved to be effective. Am I correct?
So, absolutely right. The timing, and this was not by design, it was more serendipitous, that the timing of when the vaccine trial was in the field and accruing its endpoints was at the time of the second wave. Now, the South Africans, I think, are becoming rapidly aware that the second wave was by and large with the new variant. So that really is what contributed to the explosion of the second wave, was this new variant. So this trial trialed the vaccine against the new variant. So it is with this reassurance that we can say we know it is efficacious and that it had a real impact on severe disease and death, even when exposed to the new variant virus.
Someone asked an interesting question this morning, Prof, that should a person who has taken this Johnson & Johnson jab experience adverse effects, who takes responsibility?
So it is a joint responsibility of the research team. We will obviously, we're healthcare workers. We're doing this in the name of implementation science together with the NDOH. So this is a partnership. The vaccinators are all within our general health system. And the partnership here is with the researchers. This was the way we could get access to these particular J&J vaccine doses. Our urgency is around trying to get this safe and efficacious vaccine to as many healthcare workers as we can before the possible third wave. I do want to remind listeners that there is some reactogenicity, what we refer to as reactogenicity, which actually is a good thing, right? People who've had an anti-tetanus shot or a flu vaccine will know that there's a little bit of pain in the arm. There is a feeling of being a little bit out of sorts. That tells you that your immune system is revving up so that when the virus, if the virus comes within your exposure, your immune system is going to be ready for it. So people who are lucky enough, and I want to emphasize that, lucky enough to get the vaccine soon, need to know that that reactogenicity is expected, it's normal, it will pass, it's transient, and shouldn't be considered as a kind of adverse event. Adverse events were very few, and in fact, almost negligible in the clinical trial at large. And so important that we calibrate our expectations as we go forward.
Sure. Prof, I can tell you one thing. The amount of information you've given just in this interview has assured me that this vaccine is safe. So the next logical question is, how much or when is the wait for the next batch to come in? And I ask you this because I spoke to the chair of the Business for South Africa Health Working Group, Stavros Nicolaou, yesterday, who said that every 10 days, if my mind is indeed recollecting correctly, there are going to be batches of the Johnson & Johnson vaccines being delivered into the country. Is that true? And are they for free, by the way?
So, Koli, Stavros is right. We have a 14-day, actually, you're almost correct. It's a 14-day tranche period. So every 2 weeks, we'll be getting 80,000 doses, up to a sum of 300,000 in total. Those are being provided by the Johnson & Johnson. And the further 200,000 are promised based on if we are able to use up those 300,000.
Wonderful. Prof, I must tell you that you have indeed convinced me. I can only just wait patiently now for me to get my jab. So thank you very much, and all the best to you and the team. And thank you very much for conducting these trials. Very, very important for the country. This is fantastic news. Professor Linda-Gail Bekker, she is the co-principal investigator for the Johnson & Johnson vaccine.